We continue from the session which we had stopped last time. Uh, the next is about the dosha kshaya lakshanas. अतः ऊर्ध्वम् एतेषां क्षीणलक्षणं वक्ष्यामः तत्र वातक्षये मन्दचेष्टता अल्पवाक्त्वम् अप्रहर्षः मूढसंज्ञता च. The if there is a vata kshaya, that's a reduction of the vata functions, it can result in a reduced physical activity and a reduced speech or altered speech conditions and not vitality, the reduced vitality of the body and muda samyata, a depression. और पित्तक्षये मंदोष्माग्निता निष्प्रभता श्लेष्मक्षये वृक्षता अंतर्दाह आमाशय इतर श्लेष्माशय शून्यता संधिशैथिल्यं च तृष्णा दौर्बल्यं प्रजागरणं च. The other clinical features are now the important is in case of these clinical symptoms, it's about both physical signs as well as the psychological signs. Like the mandachestata, alpavaktvam, these are the physical signs, whereas Muda Samyata is a relatively psychological. So these clinical symptoms could be of both the conditions. Similarly, in Pitakshaya, Manda Ushmagnita, that's the reduced temperature and reduced digestive capacity is a physical sign. Nishprabhata, that's a reduced intellectual activity, is a psychological sign. Shleshmakshaya Rukshata Antardaha, physical signs like Rukshata Antardaha, dryness or a burning sensation within, or it could be like Daurbalya, a general weakness, Prajagaranam, disturbed sleep, also could be the signs of Kapha. Now, Kapha Kshaya. In these conditions, Swayamnivardhananyeva Pratikaraha. The treatment would be substances with the property which can enhance these doshak gunas. Now, the issue is practically when you go into these clinical signs, you will always have some a problem like whether it is due to a vatakshaya or whether it is due to the other sorts of the pathology. Now, this is a very complex issue. More detail of this issue we will have discussion when we go into the Nidana and the Chikitsa, where the other sorts of the pathology are discussed. Now, just an example, I would like to say, like if we say Vata Mandachestara, if there is a reduced physical activity, a reduced physical activity can occur due to the demyelination of the nerve fibers and in the brain. Suppose if it is in the brain, I would consider this as a pranavata, kshaya. And if it is due to the demyelination, then only it's a dhatu kshaya, vata kshaya janyam vyadhi. If the similar reduced condition is due to necrosis, then it's a dhatukshaya vata prakopa. See, there is a difference between a vatakshaya and the vata prakopa produced due to dhatukshaya. Or if it is a space occupying lesion, it's a margavanjani vata prakopa. Now, the treatment line of treatment would be changing accordingly. So, that's about the practical issue. Now, of course, this issue becomes more complex if we go on discussing about this now itself. But we need to keep that in mind. Like it's not simply a reduced physical activity is always due to the vatakshaya. So there is a need to assess that. More detail about that we will discuss about when we discuss into the nidana later on. Similarly, there could be a lesion of the similar sort, like the demyelination, and the demyelination occur in the spinal cord. I would consider this as Udanavata Vikriti, Udanavata Kshaya. When the demyelination occurs in the peripheral lower motor neuron lesions, where there is a demyelination like the motor neuron disorders, I would consider this as a Vyanavata Kshaya. So this is how we need to consider, or maybe they apply the current knowledge to the idea of the dosha drushti as such. More details of that we will continue in the coming sessions, when particularly when you go into nidana as such. This is just a highlight. Now, the other lakshanas of the dhatukshaya are rasakshaya, shrutpida, kampa, shunyata, atrasnata. If there is a rasakshaya, the volume reduction, patients with the hypovolemia, the features would be Hrutpeda, there would be a compression or the pain in the chest, and Shunyata, a dryness, and Trishna, thirst. That's exactly the clinical signs of the hypovolemia. Of course, the further next stage there could be a hypovolemic shock, which is not really mentioned in this context. Shonita Kshaya, when there is a hypoxia or reduced oxygen concentration, oxygen carrying capacity in the body, Totparusham, there is dryness of the skin, Amlashita Prarthana. This is something which is not really mentioned in our current science textbooks, but practically it is true. A patient with anemia would always prefer to have some sour taste substances, and he will always feel hot, and then he prefers to a cold environment. This is true. Now again, when we say that cold preference, the causes could be many. It could be due to hyperthyroidism and so on. So that needs to be differentiated. Those kinds of details we'll continue when we go into the next level. But in case of anemia, patients with the real anemia, you will have these features. Shaichilum, the engorgement of the vessels. It's true that in a patient of anemia, the vessels will be engorged due to the hyperdynamic circulation. Hyperdynamic circulation is one of the complications of the anemia. And so these are absolutely the same thing which we can see clinically. Mamsakshay, if there is a atrophy of the adipose tissue, spik ganda upastha uru vaksha kaksha pindika udara griva shushkata, the dryness in those areas which otherwise look prominent, like the buttocks or the cheeks, so on, they become somewhat depressed like. Raukshatodaha, there will be a dryness, and the pain also could be seen. Dhamani Shaitilyamja, the abnormalities of the vessels. Particularly, I would translate this as the varicosities. Of course, varicosities are not always related to the atrophy of the adipose tissue, but it is true that mobilization of the adipose tissue can be a cause for the vascular changes. Pathologies of the peripheral vessels can be occurring due to the mobility of the adipose tissues. Medakshaya, in case of the abnormalities related to the blood formation and the fluid and electrolyte balance, the changes could be plihabhivruddhi, as in case of the portal hypertension. Then Sandhishunyata Roksham Medula Mamsa Prarthanaja, the patient may have a feeling of pain or discomfort in the joints, and this is one thing which is not really noted in the present clinical practice. Like the patient would prefer to have the non-vegetarian food, particular non-vegetarian food with white meat like substances are preferred. Now, a patient's liking of food related to the disease is a concept which is present in Ayurvedic theories as such, whereas in the contemporary science, this kind of an issue is not really given sufficient value. But we can see these things practically, clinically, we can see these issues. So there is a need to have a better view from the contemporary point of view about these issues, like how the patient's likes and dislikes can be a reflection to the disease. Astikshe, astishulam, dandanakhavangaha. If there is astidhatu, it can result in pain in the bones, and there could be abnormalities or fragile teeth and fragile nails as such. Then Madhyakshaya Alpashukrata. Madhyakshaya results in a reduced vitality, Parvabhedaha, Asti Nistodaha, Asti Shunyatata, a feeling of pain in the bones, long bones. Pain in the long bones is always a suggestive of a myeloid pathology. Pain in the joints is usually a sign of bone pathology. This is a general statement, of course, with a few exceptions. Shukrakshaye, if there is a abnormalities of the semen and semen production, Metra Brushana Vedana Ashakti Maithune, Chiradva Prasekaha, Prasekeja Alpa Rakta Shukra Darshanam, pain in the genital area and this impotency, it could be abnormalities of the ejaculation. There could be either delayed ejaculation, or during the ejaculation there could be even blood stained semen as such. Again, the basic concept is Swayam Vyopayoga Pratikaraha. The treatment would be by using those substances which can have the similar qualities as that of the specific dhatu. Purishakshaya, if there is a Purishakshaya, Hridaya Parshapida Sashabdasya Vayohu Gurthagamanam Kukshav Sancharananja, a emptiness in the intestines resulting in a discomfort in the chest as well as over the sides. This kind of an experience often felt when you have severe diarrhea, and Sashabdasya Vayohu Gurthagamanam, a hyperperistaltic activity can also occur. Mutrakshay Bastitodaha Alpamutratata, if there is a Mutradhatu Kshaya, Mutra Mala Kshaya, it can result in pain in the bladder area and the quantity of urine is reduced. Atrapi swayonivarthana tavyopayoga. The bastitoda alpamutrata, this can be felt in the summer when you sweat more and the quantity of urine is lesser. It's a common experience, which is typical of the Mutrakshaya. Svedakshaya Stadda Romakupata Pakshoshaha Spashavaigunyam Swedanashascha. If there is a Svedakshaya, then it results in the hair follicles and the openings of the sweat glands being quite prominent as such, and the skin becomes dry. This often occurs in those who use lots of cosmetics. If you apply a layer of cosmetics, that can result in blockade of the sweta, and that can result in eruptions. Follicles, hair follicles can be deranged, and folliculitis could be one of the common features. Spashavaigunyam Swedanashascha. Spashavaigunyam, sensory abnormalities, of course, doubtful whether it's really due to the sweat as such. Then Tatra Abhyangaha Svedopayogashcha. The treatment would be Abhyanga and Svedopayogah. Artavakshaya Yathoksya Kala Adarshanam Alpadaba Yoni Vedanacha, as in case of the PCOD conditions where the menstrual flow doesn't occur in the proper cycles, and there could be even discomfort in the genital area. Tatra samshodhanam agneyanam dravyanam nishvat upayogah. In such conditions, agneya dravya or ushnavirya dravya has to be used and shodhana has to be done. Sanyakshe stanayoho amlanata or stanya asambhavah alpatapa. Stanyakshaya can result in a atrophy of the breast tissue, and then psychological depression to the mother, and stanyasambhava reduced to formation of the milk or alpataja quantity could be lesser. Tatra Shreshmavardhana Dravyopayoga. In such conditions, Shitavirya Dravya, which can increase the comfort, are administered. Garbhakshaya, this is a very unique concept of Sushruta, Garbhakshaya. Of course, what do you mean by really the Garbhakshaya? In the sense, is it that the growth of or the milestones of the growth in the fetus is lesser, or that is it a atrophy of the fetus? Question mark. But it suggests you more clinical signs of the reduced milestones to growth, and their garbha aspandanam anunnata kukshitaja. The movements of the fetus are not felt, and the level of growth of the uterus is not according to the scheduled period, like that. Graded stages of the development of the uterus are not seen as such. This is again whether the Garbhakshaya has to be considered as atrophy of the fetus or simply a reduced growth as such. These are all question mark where we may not have a very definite answer, but a loss of movement and a failure of that response is usually sign of atrophy. तत्र प्राप्तबस्तिकालायाः क्षीरबस्तिप्रयोगः मेद्य अन्न उपयोगः इति. There क्षीरबस्ति is suggested, and the food which can increase the मेदोधातु are administered. अत ऊर्ध्वम् अतिवृद्धानां दोषधातुमलानां लक्षणं व्याख्यास्यामः. वृद्धिः पुनरेषां स्वयोनिवर्धनात् अति उपसेवनात् भवति. Vruddhi of doshadhatu mala also can occur, which is always directed to the food and lifestyle. So all that summary is both dosha vruddhi and kshaya. It can occur due to the lifestyle factors and the prajaparada. And this has a relevance now when we go into the Ranakrasnadhyaya later on, where we will discuss about the Shat Kriya Kala. This fact has a importance value there. And in that chapter, she doesn't mention about the Vruddhi. So, Vruddhi of the dosha starts from the lifestyle abnormalities, variations in the lifestyle. And later on, if it is accumulated, that results in the formation of the diseases later. So, Vatabaddhau, Vakparusham, Kashyam, Kashyam, Gatraspuranam, Ushnakamita, Nidranashaha, Alpabalattvanja. In case of Vata Vruddhi, there could be a hoarseness of the voice and reduced physical activity, or the body becomes loss of weight as such, and then the color of the body can change, and there could be abnormal movements of the body. Fasciculations can occur. Fasciculations are signs of fasciculations as well as tremors could be sign of Vata Vruddhi. Ushnakamita. Now again, in these conditions also is a similar issue, like a hoarseness of the voice could occur due to many reasons. So when it has to be considered as due to Vata Vruddhi or Vata Kshaya, these are all the issues which we will discuss later on when we go into the Nidana further as we go into the pathology. But in gross, in general, if there is a pathology which is reversible and temporary, it could be due to either the Vriddhi or the Kshaya of the dosha. If there is a pathology which is not reversible and it can result in later on consequences further involvement of more and more of the organs, in that condition we will have to consider the next stages of the pathology. More of that we will be discussing, yeah, in the later on, like whether it's a Prakopa or the Sanasanshaya or it could be the Avarana. These are all the issues which we will be discussing later on. Now, anyway, that's about the Vata Buddhi Lakshanas. Similarly, पितृवृद्धौ पीताभासता संतापः शीतकामित्वम् अल्पनिद्रता मूर्छा बलहानिः इंद्रियदौर्बल्यम्. In case of pitta vruddhi, it's pita yellowish discoloration, burning sensation, and shitakamitvam, preference for the cold. Now, that preference for the cold can occur in pitta vruddhi as well as the raktakshaya. So, when it has to be considered as raktakshaya or the pitta vruddhi, these are all the practical clinical questions where we will have to consider the other clinical possibilities where the contemporary diagnosis can contemporary means of investigations can help to make out that simply because of one single clinical sign it may not be possible to make out. Now that kind of an issue is the main part of the discussion in the consequence sessions, like or murcha balahanihi indriya daurbalyam. There could be impaired consciousness or reduced physical activity, physical strength, and the sensory perception could be abnormal. And with the Vimutra Netrutanja, there could be yellowish discoloration of the eyes or the fecal material, urine, etc. It is not, I am not saying that these are all the signs of jaundice, but there could be an abnormality, yellowish discoloration, which can occur due to simply a concentrated urine. When there is during summer again, when the urine is concentrated, you may have that yellowish discoloration. It also may be related to the food substances. When you take more of chili-like substances, that too can result in yellowish discoloration of the urine. So now that needs to be identified as a pitta vritti, whereas a established jaundice would be a next stage of the disease. So this kind of a discrimination is the real confusing issue from the practical point of view. श्लेष्मवृद्धौ शौक्ल्यं शौत्यं शैत्यं स्थैर्यं गौरवम् अवसादः तन्द्रा निद्रा सन्धिविश्लेषश्च. In Shleshma Buddhi, there could be a pale color or a feeling of coldness and the hardness in the body and reduced physical activity and nidra, excess of sleep, sandhi vishleshaha, edema in the joints and the fragility of the joints, like effusions in the joint could occur due to the kapha vriddhi. रसो अतिवृद्धः हृदयोत्क्लेदं प्रसेकं च आपादयति. Hypervolemic conditions. Hypervolemic conditions can result in the discomfort in the chest, hridaya utkleda, and then praseka, excess of salivation. Excess of salivation is something which is not noted in the current contemporary clinical methods. Raktam, now rakta vruddhi is rakta angakshita, rasa sirapurnatvam. As in case of polycythemia like conditions, polycythemia can result in more and more complications further on. So that need to be considered as a disease entity, whereas a rakta vruddhi, where the oxygen concentration can occur more, as in case of rakta vruddhi, like when you climb a mountain or so on. So in those conditions where the atmospheric oxygen concentration is lesser, the hemoglobin concentration in the blood would be increased, and this is a temporary phenomena. This could be considered as the rakta vruddhi, where that reddish discoloration of the conjunctiva is a very characteristic feature. Then mamsam spigganda usta upastha uguru bahudangasu vruddhim, a bulging in those areas where the adipose tissues are accumulated, gurugatratanta, heaviness in the body. Medaha snigdhamtatam udara parshvavruddhim kasa shwasadin daurgadhyam ja. In medavruddhi, where there is an abnormality of the accumulation of fluid in the body, it can result in a heaviness or a distension of the whole body, as such udara and parshva, abdomen as well as the sides may become bulged, and the whole body will be looking somewhat moist, as such that visible moisture is seen. And kasa shwasa din daurgandhyam, smell is another feature. Asti adhyastini adhisantanscha. Asti vriddhi can result in osteophytes, development of new bone formations, abnormal bone formations as such. Madhya sarvanga netra gauravamcha. There could be a general heaviness in the body as well as in the eyes. Shukram shukrashmarim ati pradurbhavancha. A abnormality of the shukra can result in shukrashmari. Now, shukrashmari itself is a controversial issue. There is whether really a stone can be formed due to the semen or not is a questionable thing. Virtually, there will be no such a clinical entity, a shukrashmari or a real stone formation due to the semen accumulation is not seen, whereas the prosthetic secretions can result in consultation because semen has a liquefying substance in itself and it has a property of getting liquefied once it is discharged. And that is one of the essential qualities. Whereas prosthetic secretions may result in concretions. Now, these are all the other controversial issues. So, more and more of those controversial issues we will deal with the later on. So, there are many controversial issues which need to be explored when we go into the next level. So, for the present, I will just stop at that level. Similarly, Purisham Atopam Kuksha Shulam Te Mutram Mutavritim Muhu Pravritim Bastitodam Adhananja Svedahat Tato Darugandam Kandunja. So Purisha Vritti can result in a pain in the abdomen, Mutravritti, the total quantity of the urine could be increased and the frequency of the micturition also can be increased and there again can be Bastitoda Adhana, distension of the abdomen and pain. Svedahat Tato Darugandam Kandunja. Sweda can produce a Sweda's increase can result in the smell, abnormal smell and itching. Arthava Mangamartham Ati Pravurtim Daurgandhya. Arthava Vruddhi can result in Ati Pravurti Daurgandhya smell as well as Angamartha, general pain in the body. Stanyam Apinatvam Muhurmuhu Pravurtim Todanja. These are all relatively simple conditions like which are not really practically clinically seen as such and most of these patients may not come to you in the clinical condition clinical practice because vruddhi or kshaya would be a temporary reversible phenomenon and hence from the clinical point of view in general vruddhi and kshaya would have a lesser significance from the treatment point of view. When a patient comes to the clinic, usually the patients come to you at a later stages. Whereas from the practical point of view, for your own self-assessment and prevention of further diseases, these symptoms are quite important. So these symptoms of Vruddhi and Kshaya are important from the point of view of prevention of the disease, may not be very significant in the practical clinical conditions for the treatment because most of the patients will come to you at a later stages. A patient coming to you at a real Vruddhi and the Kshaya would be significantly lesser. That doesn't mean that it has no importance, but from that's the usual thing which you have to keep in mind. यथास्वं संशोधनं क्षपणं च क्षयादि विरुद्धिः क्रियाविशेषे प्रकुर्वेत. So the treatment would be the opposite qualities. Now there is another concept which is really again bit confusing like पूर्व अतिवृद्धत्वात् वर्धयति परं तस्मात् अतिप्रवृद्धानां धातूनां ध्यासं हितम्. So if there is one dhatu which has become increased quantitatively as well as quantitatively it has increased, it can affect the next dhatu and this can go on as a sequential progress and hence the treatment has to be done as early as possible. Of course, practically to explain this in the clinical conditions would be quite difficult as such. Now, after the dhatus, the next is about the ojas. The ojas is also named as a bala. Balalakshanam, balakshayalakshanam cha ato urdhum upadekshyaamaham. तत्र रसादीनां शुक्रान्तानां धातूनां यत् परं तेजः तत् खलु ओजः तदेव बलम् इत्युच्यते स्वशास्त्रसिद्धान्तात्. The same is considered as bala. Now, how to assess the bala or the ojas from the contemporary science point of view, that's another of the controversial issue. Now, I would look at the ojas as a homeostatic principle. I will come to that part later. तत्र बलेन स्थिर उपचितमांसता सर्वचेष्टासु अप्रतिघातः. The because of the ojas, you will have a maintenance of the body. The nourishment of the body is maintained properly, and it gives you a perfect reflex the activities. Sarvachestasu apratigataha. All your activities will be without any obstruction. All the activities being without any obstruction is the major function of what we call as the homeostatic principle. Swaravarna Prasadaha, the maintenance of a quality of your voice and then the texture of the body. भाषाणाम् आभ्यन्तराणां च कारणानाम् आत्मकार्यप्रतिपत्तिः भवति. If there is any stress from either internal or external causes, and that stress is relieved and recovery from the stress is the भाष्याणाम् आभ्यन्तराणां कारणानाम् आत्मकार्यप्रतिपत्तिः is a reversal of the stress phenomena. Now this reversal of the stress phenomena is again a very complex phenomena where every system of the body is involved. In brief, the whole reversal of the stress phenomena or the homeostatic mechanism can be explained as a variable sensation. Once there is an imbalance of any sort of the activity, that imbalance results in a detection or detection of that imbalance body. There is a system to detect that imbalance, and then the imbalance is controlled by a higher center, and this results in an effective activity, and that results in maintenance. So this kind of a mechanism is present in every system of the body. Every system, you go for any biochemical function of the body, every biochemical function would have a sensor or a mechanism by which the quantity is expected, or the total progression of that biochemical activity is assessed, sensitized, and then again it is controlled. So regulation, there will be always something like a system of brake and the accelerator, and that brake and accelerator being controlled by a control center. This is the what we call as the homeostatic principle. And to go into every detail of the homeostatic principle is again a very huge task. So whenever we study any biochemical activity, that homeostatic principle has to be studied as such. But most important and the very significant homeostatic principle in the body is what we call as a hypothalamus pituitary adrenal axis. Now, whenever there is a stress, that stress results in stimulation of the hypothalamus, and the pituitary produces its secretions, either it's increased or reduced, and this the pituitary is the master of all other endocrine organs. So endocrine organs of different systems would be either activated, or it could be the adrenal cortex, which again is directly linked to the pituitary axis, which regulates all other functional organs like the heart, muscles, and so on. And this results in a total balanced activity. The most significant homeostatic principle is the hypothalamus pituitary adrenal axis. Now, I don't say that hypothalamus pituitary adrenal axis is the Voja, but uh, that's the most significant visible. So signs of Vojas and the Vojas abnormality can be seen whenever there is a variation in the HPA or hypothalamus pituitary adrenal axis as such. But it's not only that much. Every biochemical activity would have a cycle of this sort where there would be a sensory and there would be a resulting effector system. So that needs to be studied. Now, the qualities of the Vojas is mentioned as if it is a physical substance. It's not really a physical substance. Of course, in Vagbhata, you will also find that the quantity of the ojas as Astabindu. Now, when this, whether it has to be Astabindu like 8 drops, whether it has to be measured or not, it's again a big question. I don't think that it can be measured as such. But the other ways, the qualities of course can be attributed which can improve the functions of the ojas are the ojas is considered as a Shita and hence Somatmakam, it's a Shita Guna, and Snigdam, Shuklam, Shitam, Stiram, Saram, Viviktam, Mritsancha, Pranayatanam Uttamam, the Shita functions, the anabolic functions would be facilitating these homeostatic mechanism. To a certain extent, this statement is true, but it's not perfectly true from the contemporary science point of view. If I say that anabolic functions stimulate the homeostatic mechanism, to a great extent it is true, with a few exceptions. देहः सावयवस्थेन व्याप्तो भवति देहिनः. It's present throughout the body. As I said, that homeostatic mechanisms are present throughout the body. तदभावाच्च शीर्यन्ते शरीराणि शरीरिणाम्. If this mechanism doesn't exist or doesn't function properly, it can result in destruction of the whole body. अभिघातात् क्षयात् कोपात् शोकात् ध्यानात् श्रमात् क्षुधः ओजक् संशीयते हेभ्यः धातु ग्रहणनिस्वदम्. तेजस्समीरितं तस्मात् विश्रंसयति देहिनः. The injuries, physical injuries, are simply due to abnormal functions, kshaya, reduced functions as such, or kopat, abnormal biochemical reactions, shokat, emotional disturbances of shoka and adhyana, or physical stress, or sustenance of severe hunger, and this can result in ojakshaya. Abnormalities, homeostatic abnormalities can occur due to any sort of the stress. So, homeostasis is the stress busting mechanism, and extreme stress can result in imbalance of the homeostatic mechanism. This is a general statement, and whatever is mentioned as the causes of the ojakshaya, they are the different forms of the stress as such. Now, the Oja abnormality of the Ojas are categorized as विश्रंस व्यापक क्षय त्रयोदोषाः तस्य विश्रंस व्यापक क्षय इति त्रयोदोषाः लिङ्गानि भवन्ति सन्धिविष्णुकेशः गात्राणां सदनं दोषच्यवनं क्रियासनिरोधश्च विश्रंसे स्तब्धगुरुगात्रता वातशोकः वर्णभेदः ग्लानिः तन्द्रा निद्रा च व्यापन्ने मूर्छा मांसक्षयः मोहः प्रलापः मरणमिति च क्षये. Now, these clinical symptoms are typically seen in case of the abnormalities of the hypothalamic pituitary axis conditions or adrenocortical axis abnormalities. When there is a HPA axis is slightly depressed, early depression, it results in a reduced physical activity, something like being idle, and the intellectual functions also will be reduced, and movement of the muscles would become lax as such. This is one of the common situation. Now these symptoms can be seen whenever you stress yourself more. When there is excess of stress, this can be seen where the hypothalamic pituitary axis would be either functioning significantly faster or maybe stressed too much. Now, when it is becoming the next level, when the pituitary axis has become impaired, and there is a tendency for the irreversible, that's what we call as the stress tolerance failure, or is that's also called as criticality of the stress as such. In that condition, there could be Stadda Gurgatrata, Vatashopha, Varnabhedaha, Glanihi, Tandra, Nidracha Vyapane. When there is a Vyapat or that stress failure, stress tolerance failure, criticality as such, in that condition, all the reflex mechanisms would be affected. Patient would not go into shock, but there is a tendency to go into the shock. Total physical activity lesser, circulatory pressure will be altered significantly. Cardiac functions also tend to be altered. This is what we see clinically quite significantly. Whereas in a serious stress failure, total stress tolerance failure as such, there could be murcha, mamsakshaya, moha, unconsciousness, or even death can occur. Now that's the condition where you need to administer steroids. So most of the patients where we administer steroids in the clinical conditions, these are the typical features which you see in case of the Oja Kshaya as such. So Oja Kshaya is the extreme failure of the stress mechanism. So these can be clinically seen in case of hypothalamus pituitary axis abnormalities. That's the point. Right. त्रयोदशा, the same is summarized again. त्रयोदशाः बलस्योक्ताः व्यापक विश्रंसनक्षयाः विश्लेषसादौ गात्राणां दोष विश्रंसनं श्रमः अप्राचुर्यं क्रियाणां च बल विश्रंसलक्षणं गुरुत्वं स्तन्त्राङ्गेषु ग्लानिः वर्णस्य भेदनं तन्द्रा निद्रा वातशोभः बल व्यापतिलक्षणं मूर्छा मांसक्षयः मोहः प्रलापः अज्ञानमेव च पूर्वोक्तानि च लिङ्गानि मरणानि च बलक्षये. Now this is the same repetition in the form of the shloka. If at all you are interested in that the stress failure condition, that patient who is in 332 now, Bhagi, who is admitted repeatedly, a patient of diabetes and who developed septicemia, urinary tract infections, that clinical course of the patient is very typical of the stress failure conditions. And many times she was given steroids and she had recovered partially. So that's the typical Oja Kshaya Lakshana. The patient has a Oja Kshaya Lakshana as such. So you can see that patient. तत्र विश्रंसे व्यापन्ने च क्रियाविशेषैः विरुद्धैः बलम् आप्यायेत इतरं तु मूढसंज्ञं वर्जयेत. So if Vishrams and Vyapana conditions, they can be managed clinically with the typical supportive measures, whereas in Oja Kshaya, Sushruta had considered this as Vajja, it cannot be treated. So now, of course, you can treat with the supplementation of steroids. Glucocorticoids can be administered temporarily, it can improve. Some of the patients may improve, some may not. दोषदातु मरक्षिणः बलक्षीणो विवानरः स्वयो निवर्धनं तद अन्नपानं यत्तद् अन्नपानं प्रकाङ्क्षति यद्यद् आहारजातं तु क्षीण प्रार्थयते नरः तस्य तस्य तु लाभेतु तं तं क्षयमपोहति यस्य धाक्षयाद् वायुः संज्ञां कर्म च नाशयेत् प्रक्षीणं च बलं यस्य नासौ शक्यः चिकित्सितम्. A general guideline of treating these patients of the doshadhatu vruddhi kshaya lakshana are, in general, once there is an abnormality in the physical condition, the patient would have a reflex activity where the same is desired by the person. Now, this issue, I think, as I have told, like a preference for the food material and a demand for the food material, which as a physiological activity, is existing practically, but contemporary medical science doesn't give much value to this issue. To a certain extent, in case of anemia, the desire to eat soil, this is somewhat related. You may find a few references in the medical textbooks, but this issue is not given sufficient scope in of study. But practically, this is true. So, and that's one area where we can have a better study, better research, and it can be utilized practically. Like a patient having a preference for certain food material at certain situations, how it can reflect upon the disease. That's one of the important research areas which can be done and which can give you a significant outcome in future. So that's the basic issue. Whereas when dhatukshaya samjam nash karma cha nashet, if there is a absolute loss of function or the patient's consciousness is impaired, then that results in a incurable condition according to Sushruta. Pakshinam jabalam yasya nasau shakyahti kitsitam. So when there is a very gross abnormality resulting in impairment of the consciousness and all the functions are affected, then it can become incurable. So there could be incurable failure conditions. Now, of course, in the present day situation, you may manage them with the life support conditions. Now, that's exactly what we say as in when that the normal physiological homeostatic mechanisms are not able to maintain, then we need to have a life supporting mechanism. So, life supporting mechanisms are necessary, otherwise, the patient would die as such. Now, the next part is about another diversion from basic topic about from the dosha dhatu kshaya to sthaulya and the kasha, obesity and the cachexia. रसनिमित्तमेव स्थौल्यं काश्यं च तत्र श्लेष्माहारसेविनः अध्यक्षणशीलस्य अव्यायामिनः दिवास्वप्नरतस्य च आम एव अन्नरसः मधुरतरश्च शरीरम् अनुक्रामन् अतिस्नेहात् मेदो जनयति तदतिस्थौल्यम् आपादयति तम् अतिस्थूलं क्षुद्रश्वासपिपासा क्षुतु स्वप्न स्वेदगात्रदौर्गन्ध्य कथन गात्रसाद गद्गदत्वानि क्षिप्रमेव आविशन्ति सौकुमार्यात् मेधसः सर्वक्रियासु असमर्थः कफमेधो निरुद्धमार्गत्वात् च अल्पव्यवायः भवति आवृतमार्गत्वात् एव शेषाः धातवः न आप्यायन्ते अत्यर्थम् अतो अल्पप्राणः भवति प्रमेहपीडका ज्वर भगन्धर विद्रदि वातविकाराणाम् अन्यतमं प्राप्य पञ्चत्वम् उपयाति सर्व एव चास्य रोगाः बलवन्तः भवन्ति आवृतमार्गत्वात् स्रोतसाम् अतः तस्य उत्पत्तिहेतुं परिहरेत् उत्पन्ने च now probably this might have been a question in the classroom, like when about the dosha dhatu and linkage of one dhatu resulting in the involvement of the other dhatu. Somebody might have asked a question like, what about this link in case of the obesity and the cachexia? So that's actually not in continuation with the topic which is being discussed as such. And Staulya Kasha also are discussed separately in the later chapters as such. So that's probably it's a classroom discussion and maybe due to the questions there. Now, due to consumption of kapakara ahara and excess of food, reduced physical activity, and those who tend to sleep more in the daytime, that results in accumulation of the medas. Now, this is a general notion is when the patient has obesity, it's always considered as the generally considers the adipose tissue, but practically majority of the patients who are on the obesity type, they will have more of accumulation of the fluid and electrolytes. Abnormality of the fluid and electrolytes is the major cause, whereas the real accumulation of the fat resulting in the fatness or obesity is of a lesser significance. So, more of that issue and more detail about that we will discuss in when we discuss about the Staulia cassia as a disease in the coming chapters, the different types of the obesity and so on. Now, the once the patient's body weight increases, the patient becomes obese, it can result in impairment of all the physical activities, and the sexual activity also become reduced, and it can result in consequent other diseases, and there could be complications like Prameha etc. So that, and it can even become fatal. And the general line of treatment for these obesity conditions are Shiladitu Guguru Gumutra Tifala Loha Rajo Rasanjana Madhu Yava Mudga Kora Dusha श्यामाक उद्दालकादीनां विरूक्षणच्छेदनीयानां च द्रव्याणां विद्युदुपयोगः व्यायामः लेखनदस्ति these are the general concepts of the treatment. Now, more detail about that, we'll have more opportunities when you go into the Staudia as such. Now, in general, without going into more of the details, one of the basic issue which is known to be there in case due to that excess of consumption of the food and the reduced physical activity, the one very well known mechanism is the insulin metabolism effect. So consumption of the food, excess as well as a reduced consumption of the food can result in insulin resistance, and insulin resistance is now considered to be the earliest changes which occur in majority of the obesity conditions, and which is directly related to the food consumption and physical activity. So food consumption and the physical activity maintains the normal insulin maintenance, and that insulin starvation paradigm can occur both due to the overflow as well as a reduced flow of the substances, food substances into the cells. Now this is always related to the diabetes, and not always related to the diabetes, but obesity and the diabetes link is explained that. Of course, more of that we will continue when we discuss more about that Prameha and other vyadhis later on. So this is just a brief about that. तत्र पुनर्बातल आहार सेविनः अति व्यायाम व्यवाय अध्ययन भय शोक ध्यान रात्रि जागरण पिपास क्षुत कषाय अल्पाशन प्रभृतिभिः उपशोषितः रसधातुः शरीरम् अननुक्रामन् अल्पत्वात् न प्रीणाति तस्मात् अतिकाश्यं भवति. सो अतिकृशः क्षुत् पिपासा शीतोष्ण वातवर्षा भार आदानेषु असहिष्णुः वातरोगप्रायः अल्पप्राणश्च क्रियासु भवति. The reverse of this is the kasya, the emaciation, and the basic cause of emaciation is a consumption of vatalahara or excess of physical activity or adhyayana. Adhyayana doesn't mean reading more, but having only single form of the activity. So a person has to have a diversion of the activity. If the same is done, repeated use of any of the functions of the body, and only that activity, limited to that activity, is adhyayana. So adhyayana need not be translated as a study. So it's not study alone. Study of diverse subjects doesn't result in kasya, don't worry. Now, then the emotional disturbances like bhaya, shoka, dhyana, etc. also can result in the kasya, and kasya can result in the reduced tolerance to the stress. Kshutipasa, shita, ushna, varsha, bharadeneshu, asahishnu. The stress tolerance of the person is reduced. Vataroga praha, it can result in vataroga, and alpa pranashta, the vitality of that patient would be reduced. And it also can result in the diseases like Shwasa, Kasa, Shosha, Priha, Udara, Agnisada, Gulma, Raktapitanam, Anitamam, Asadya, Maranopayati. It can result in fatal complications by producing many other sequential disorders. Now, how that emaciation and the diseases like Udara, Agni, Gulma, etc., abdominal disorders, we will continue, we will have more discussion about that issue in the coming sessions when we go into the other details. सर्व एव चास्य रोगाः बलवन्तः भवन्ति अल्पप्राणत्वात् अतः तस्य उत्पत्तिहेतुं परिहरेत्. So it is a preventable, it has to be prevented. Utpanne tu payasya ashwagandha vidari gandha shatavali bala atibalanam nagabalanam cha madhuranam anyasam cha aushadhinam upayagah. Madhura dravya has to be used. Kshira dadi grita mamsa shali sastika yava godhumanam cha diva swapna brahmacharya avyayama brahmana basti upayagasteti. Brahmana basti and all that shita viridravya anabolic activities have to be enhanced. यह पुनः उभय साधारणानि आसेवेत तस्य अनरसः शरीरम् अनुक्रामन् समान धातून् उपचिनोति समधातुत्वात् मध्यशरीरः भवति सर्वक्रियासु समर्थः क्षुत्पिपासः शीतोष्ण वर्ष आतपसः बलवांश्च स सततम् अनुपालयितव्यः इति and hence always there should be balanced activity. There should neither be too much of activity or too less of the activity. It's related to every aspect, food as well as the physical activity, it should be balanced. So Madhyama Dharma is the preferred asset. Now the summary further. अत्यंत ग्रहिष्ठव्येतौ सदा स्थूल कृशौ नरौ श्रेष्ठो मध्य शरीरस्थो कृशः स्थूलात्तु पूजितः. The both Krusha and Stula are difficult to be treated. Madhya Sharira is always better, and comparatively better than Stula. Krusha is better than Stula. This is a general concept which is practically true also. Dosha prakupito dhatun kshapayati atmatejasa idha sudejasa vanhi ukhagatam iva udakam. A vitiated das. Now whatever we have discussed is the Vruddha Dhatu. Now the next level is the Prakopa, and what is that Prakopa? All that we will be discussing when we go into the Brahma Prasnadhyaya later on. And once it becomes Prakopita, this gets displaced, it can result in the involvement of the other dhatus, and it simile is given to like a water which is dried up in a this hot chamber. Ukha is a hot chamber, so if water is kept in a hot chamber, it gets dried up. Similarly, a vitiated dhatu can result in involvement of more and more of the dhatus. वैलक्षण्यात् शरीराणाम् अस्थायित्वात् तदेव च दोषधातुमलानां च परिमाणं न विद्यते. To exactly assess the doshadhatu quantities, parimana, quantity, is not practically possible because the whole condition is in a dynamic condition. The shariranam asthayitvat, the whole body, all the functions are in a dynamic condition. This is what I have mentioned. It is a biological activity and a continuous biological activity. A quantitative assessment is practically not possible. But still it's guessed, like whenever you say like quantitative assessment, then it's a general guess. येषां समत्वं यच्चापि विषग्भिः अवधार्यते न तत् स्वास्थ्यादृते शक्यं वक्तुम् अन्येन हेतुना. Even the balanced condition also has to be assessed indirectly by the signs of proper health. दोषादीनां तस्मताम् अनुमानेन लक्ष्येत अप्रसन्नेन्द्रियं वीक्ष्य पुरुषं कुशलोभिषक्. The assessment of the dosha status has to be always by anumana pramana, by looking at the clinical signs produced in the person and regarding the either perception of the person of sensory perceptions as well as the physical activity of the persons are the parameters by which you can assess the status of the dosha. It cannot be directly measured. स्वस्थस्य रक्षणं कुर्यात् अस्वस्थस्य बुद्धिमान् क्षपयेत् गुम्हेच्चापि दोषधातुमलान् भिषग् तावद् यावत् अरोगस्यात् सात्म्यस्य यावत् सात्म्यस्य रक्षणम्. So you need to maintain the balance, and that balance has to be maintained by either reducing or increasing the quantities of the dosha, and till the signs of proper balance is maintained. There is another of the controversy, like whether Kshina Dhatu, Kshaya Dhatu should be treated or not. In Charaka, you have that discussion. We will discuss that part also in due course of time whenever there is a relevant context. The definition of a healthy person is samadosha, samadishta, samadhatu malakriya, prasanna atmendriyamanaha swastha ityabhidiyate. This is a very popular statement. The definition of a health is not only the physical activity, even psychological activity and the social activity also has to be considered as a definition of the health. And the recent WHO definition of health is a copy of the same. Now with this we conclude the present chapter. सुषुप् संहितां सूत्रस्थाने दोषधातु मलवृद्धि क्षयवृद्धि विज्ञानीयः नाम पंचदशोऽध्यायः. A summary, of course, concept of dosha and dhatu are unique concepts of ayurvedic perception, and they cannot be translated through contemporary perception. And Ayurvedic view of body is more focused on functionality than structural details. Homeostasis is the ultimate factor which maintains the optimum healthy status of the body. Definition of health in Sushruta is a golden benchmark forever. With this, we'll conclude. And if there are any questions, there are some questions like in scanty and irregular menses, we give Chandraprabha and Kumari also, which are the Shitavirya. How does it? Kumari is not Shitavirya, Kumari is Vishnuvirya. And it's not that in every patient it is the same treatment. No, that's the point. See, when there is a Kapha Lakshana, then like polycystic ovarian disease, that's where Kumari is given. Or Rajapravartini Vati has also has the Hingu and it's having Ushnavirya. So Kumari is not Shitavirya. There's a wrong perception. Then, sir, can you quote a few examples for anabolic function stimulates homeostasis or immunity? See, simple anabolic function is like when you are too much tired, if you take some nourishing food, you feel better. That's the anabolic stimulation. Like when you are very much tired due to the exhaustion, due to the heat, you take sharbat, and that sharbat consumed will make you feel better. That's the best of the example. Simple methods of anabolic functions stimulating, but not that it is a treatment there as such. So when it goes to the next level, you need to have the other treatment as such. So now can we understand interlinks between Vriddhi and Kshaya of Dhatu in modern perspective? That's what I said. Now I think I have tried to say the same thing. Like in a modern perspective, the early stages of the disease formation are not really recognized. So practically in the clinical conditions too, in practical clinical conditions, the patients may not come to you with the Vriddhi Kshaya Lakshanas. They are neglected. So by the time the patient comes to a physician, usually it goes to the next level. But these Vriddhi-Kshaya Lakshanas can be experienced by anyone in day-to-day activities. You yourself can appreciate that Vriddhi-Kshaya Lakshana every day. And being an Ayurvedic graduate, we can assess this and we can prevent the next level as such. This is something like when you feel more tired and you take rest. When you eat certain specific substance, you may feel some discomfort. And next day, you do not take the food or maybe modify the food consumption. That would be like if you had a party on the day, some other day, next day you don't, or maybe in the night you don't take any food or take only ganji, next day you will be normal. So this is the issue. Of course, more of this issue we'll again have a opportunity to discuss when we discuss about the Shasti Rupakrama, this Kshatriya Kala in the next coming sessions. There we will discuss about these issues more detailed as such. I think that's the simple answer for that. That's it. With that, we'll conclude. Okay, thank you. Conclude.